Hello, I am Dr. Christian España Schmidt, hospitalist at Danbury Hospital. This lecture is an introduction to procedural medicine in Danbury Hospital. In this lecture, we will learn some of the way the Danbury Hospital has designed to facilitate procedures in medicine. Also, we will familiarize with the thorough paracentesis kit. It is very important to pay attention to this lecture since there are details that are not typically taught to the internist in our hospital. All of you who are going to cardiology, intensive care, even in the office, need to have some background in procedural medicine. In this talk, I want you to have an idea of how the Danbury Hospital has designed the way to do bedside procedures. The informed consent is of the utmost importance. It should be obtained always before any invasive procedure. These are some of the parts of the informed consent. Voluntarism means that the patient agrees to the procedure and is not being forced. The patient should have capacity, or its POA, to decide whether or not to have a procedure. Always disclose the benefits, risks, and if there is any other option to the procedure that is going to be performed. Make sure that the patient or the POA understand the consequences, benefits of the procedure, and there is a shared decision making. Danbury has a procedural cart. This is the reason that the nurses' station don't have the equipment for procedure. There is a general procedure cart, and this cart is the one that we're going to describe. The name is surgical cart. There is also central line cart, thoracentesis cart, cold blue cart, and others. All are, however, very similar. The surgical procedure cart is almost or has almost everything in it. The surgical cart comes locked. However, the combination is right there. In here we see the knobs for the combination, the name of the cart, how to unlock it, and how to lock it. This is common for all the procedure carts in Danbury Hospital. Then we see the knobs to open it. Here we see how to open the cart. The combination first, and then you just turn the knob. Open the drawer, and you have opened your procedure cart. The cart has a biohazard sharp container, which comes handy. The drawers of the surgical cart has many equipment inside. In here you see ABG syringes, scalpels of different sizes, and a different array of patches. Also, you don't need to ask pharmacy for lidocaine since it is inside the surgical cart. You will find micropore. You also will find povidone and other applications for asepsis, 10 ml syringes, chloroprep. There will be an array of surgical gloves, sterile ultrasound probe covers, and sterile cups. It is important to know that the Danbury Hospital Laboratory wants all the samples of fluids in sterile cups like these, except for lumbar punctures. Here, one of the ultrasound covers. You will find also drapes of different sizes, surgical gauze of different sizes. Most of the carts will have a multi-lumen central line kit. Appropriate drapes. Also, in this cart, we see a Mahur cath for dialysis and a set of clamps for the drapes. You will see towels and universal central line bundles. Masks with eye protection. I definitely recommend to use masks with eye protection in any procedure. Head caps, shoe covers. The cart will not have vacuum bottles. Also, will not have joint aspiration kits or paracentesis kits. All of this needs to be asked to the nurse separately. Remember also the LP kit needs to be asked separately to the nurse. Here I just want to summarize very quickly how to prepare a room. First of all, the surgical cart does not fit the room, so it is very important to prepare the place where you are going to perform your procedure. The procedure will be performed with the patient at the bedside or at his bed or her bed, and the patient's room are usually disorganized and dirty. It is your duty to prepare the room properly. Also, to place the bed in a comfortable position for you and the patient in order to maximize the chances of having a successful procedure. The patient table is a very useful asset, but usually it's dirty, so careful clean it with Clorox of peroxide. This is our thoracentesis kit. In this case, this kit does not include lidocaine, so the surgical cart comes handy. Always clean your hands first and carefully remove the top of the procedural kit. Once you have it out or uncover, place your sterile gloves to take out the package. After cleaning the table, of course, you can unfold the package kit and create a sterile field. Do not touch non-sterile surfaces. If you do that, change your gloves. The kit comes with a 2000 ml bag that you can attach to the tubing system if you will drain the cavity with gravity. Again, this one did not have lidocaine. This is the sterile drape that comes with the package. Please note that the center and lateral white paper, this is protecting the glue of the sterile drape so you can safely attach it to the place you perform your thoracentesis or paracentesis. Take off the protector paper from the glued part of the sterile drape before applying it so it does not move. So what is this white drape? This white drape comes handy to extend your sterile field. Think that there is your patient with the blue field already placed, and then you have the white field to place equipment and samples. These are valve tubes used for thoracentesis. They will let the fluid flow but not air. They need to be positioned correctly in order to work properly. These are the valves. This is the tube we usually use for paracentesis. On the bottom you see the trocar that goes into vacuum bottles, and on the top you see a rolling valve. The rolling valve here is closed and here it's open. You need to roll back and forth, and will come handy when you are changing vacuum bottles or other receptacle where you are getting your fluid out. This trocar needle is used to connect the tubes to a vacuum bottle. You can see it is very large bore. The kit comes with a 50 ml syringe and also comes with a 10 ml syringe. The 50 ml syringe is the one you will use for sampling. The 10 ml syringe is the one that you will use for placing lidocaine. It also comes with a trocar needle that you can use if you are just gonna have a sample of the fluid. Always use the ultrasound and have a certified staff member with you. The chlorprep comes in the kit. You need to break the chlorprep to make the fluid go to the sponge before applying it. You can see here how to break it, and then you can milk it and you will have your chlorprep in the sponge right before application. This is where you will put all the needles, the red dot. This is a sponge and will protect you from accidents. Put all the needles there. This stylet will be handy to perform a small incision in the skin of the patient before advancing the trocar that you're going to use for aspiration. The incision is as small as these two red dots I have placed in the tip of the stylet. Again, the incision is really small and just enough to allow the catheter to pass through the skin. If you do not do an incision, your catheter may fall over the needle and you may have a failed procedure. Again, use the red dot or the sponge to put your stylet. This is a catheter that is over a trocar. It has a 3-way valve and 3/5 syringes. It's a catheter over the needle. So you will try to, at the same time that you are applying pressure through the catheter with your dexterous hand, you will aspirate in this way. You will apply pressure, aspirate, and advance the catheter through the skin of the patient. Of course, you already use lidocaine and you perform a small incision in order for the catheter to pass. As you can see, the needle runs inside the catheter. If you were to pull the needle completely, it will not fit again. So advance the catheter through the needle. You need to advance the catheter and try not to move the needle so you can have the catheter placed and the needle out. The needle again will not go back in the catheter. Please do not attempt this since you can have an accident. Use the red dot for all your sharps. This is how the 3-way valve works. It shoots down the flow wherever the sign-off is positioned. In this case, the lateral hole is open, giving free pass to the fluid through the catheter. See how you can move the 3-way valve. So here it's pointing toward the off is pointing towards the catheter and the system is closed. Again, similar here, the off sign is pointing towards the outlet and the system is off. And here is pointing towards where the needle was and the system is open. You can now aspirate from the cavity. This is where you attach your syringe for sampling. A band-aid is always included in the kit, and if you did everything right, it's the only thing that you will need for doing hemostasis. Here is how you open the band-aid. The unused lidocaine and all needles should be disposed in the biohazard container, either in the room of the patient or in the surgical cart. This is the cup to send your samples. Always make sure the nurse print all the labels. One label always goes stick to the cup, and the other labels will be placed in the back part of the specimen bag. Here, a specimen bag. All samples should be placed in the specimen bag before leaving the room. All nurse stations have specimen bags. Thank you. Like this video and subscribe to the channel so you know when there are new videos. Do not attempt any procedure you are not certified in without an attending or a certified staff with you. Thank you again.